This is All India Radio, Shillong, the Northeast News Bulletin, read by Miranda Blah. In the wake of COVID-19, we appeal to our listeners not to lower their guard, take all precautions, and all those above 45 years of age who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. National helplines are operational for providing COVID-related information and guidance to the people. The national helpline number is 011-2397-8046 and 1075, and the helpline for Meghalaya is 108 and 1070. And now the news in detail. In Assam, the Education Department has decided to cancel high school leaving certificate and higher secondary final examinations due to the prevailing COVID situation. The decision was taken yesterday in a meeting held between Education Department and various organizations in Guwahati. Education Minister Dr. Rajnath Singh said the Health Department informed that the situation is not conducive to hold examinations. He said that after discussions with all stakeholders, the Education Department has decided not to conduct examinations. The minister said that 2 committees will be set up to decide the marking patterns and final results to be declared by 31st of July. Union Defence Minister Rajnath Singh visited the 300-bedded COVID care hospital at Sarusajai in Guwahati yesterday. The hospital has been set up by the Defence Research and Development Organisation. Assam Chief Minister Himanta Biswa Sarma accompanied Mr. Singh during his visit. The Defence Minister appreciated the work of the DRDO. Meghalaya Cabinet yesterday approved the amendment of the Meghalaya Civil Service Rules 1975 and entitlement to receive remuneration at the rate of the last paid drawn minus pension plus allowances as may be admissible from time to time. The Cabinet also approved the proposal to frame the Meghalaya Forensic Science Laboratory Service Rules 2021 and to appoint full-time directors to strengthen the functioning of the Forensic Science Laboratory. It also approved amendment of the Meghalaya Goods and Services Tax Act 2017, retention of registration mark of old motor vehicles and redevelopment of government lands for availing of loans for the purpose. Meghalaya Health Minister A.L. Hek informed that the state government yesterday held a meeting with the private hospital owners and decided to constitute a consultative committee to address the issues faced by the private hospitals and patients with regard to the pricing for COVID treatment. Addressing the press, he stated that the consultative committee will take a decision on putting a cap on the prices for the treatment of COVID. He further added that the containment and vaccination measures put in by the district administration is for the benefit of all. As of now, no decision has been taken to lift the restrictions imposed in the state, but the district administration can decide on the relaxation steps. Urging the citizens of the state to get the vaccination, the health minister said that the state government is doing its best with limited resources to provide healthcare facilities to all people. Manipur Chief Minister N. Biren Singh yesterday launched Ayush 64, a poly-herbal formulation in the state in Imphal. Speaking on the occasion, N. Biren Singh stated that the use of Ayush 64 tablet had been approved by the Ministry of Ayush, Government of India, for use by adults above 18 years of age in treatment of asymptomatic, mild and moderate COVID-19 patients. He also said that the tablet is purely organic and will not have any side effects. He also added that the state government had been taking up all necessary measures to curb the spread of the pandemic and also sought support of all the stakeholders in its fight against it. In Nagaland, the daily COVID recoveries continued to outnumber fresh infections for the last 7 days. The state yesterday reported another 362 recovered cases with 56 fresh cases, with the recovery rate improving to 86.67%. The total recovered cases has increased to 20,887. Of the total 24,097 confirmed cases, the state's active cases dipped to 2,059. The state also added 1 new COVID death to the list, taking the cumulative number to 453. And with that, we end the Northeast News Bulletin, which came to you from the Shillong station of All India Radio. Have a nice day.